Hey y'all, it's your girl Sonja, and welcome back to She Say Sports. Today I have with me Dr. Michielle Fisher-Mills, certified board internal medicine doctor in Dallas, Texas, and Dr. Tiffany Latham, cardiac surgery nurse practitioner in Fairfax, Virginia. Hello, ladies. How are you today?
Hello. How are you?
I'm doing well. I'm doing well, girl. Well, ladies, I'm sorry.
Wonderful.
So, thank you so much for joining me today to discuss a very, very important topic. But before we get started, tell the listeners just a little bit about yourself. Tiffany, you can start.
So my name is Dr. Tiffany Latham, and I am originally from Jackson, Mississippi, born in New York, but grew up in Jackson, Mississippi. And so Sonja and I have known each other for a number of years, practically all of our lives. I currently work as a cardiac surgery nurse practitioner in Northern Virginia, and from an educational standpoint, I have a doctorate in nursing practice.
Awesome. And Michelle?
Yes, I'm Dr. Michielle Fisher, and I'm from Dallas, Texas, and I am an board-certified internal medicine and geriatric medicine physician, and I'm currently practicing for the Dallas County Hospital System. I do house calls for our elderly, frail geriatric population.
That is so cool. Wow, that's you don't hear people doing house calls anymore, so that's really nice.
Yes.
And go ahead. I'm sorry. Go ahead.
Oh no, go ahead.
No, go ahead, doctor.
So I was saying, as I'm internist and I'm a geriatric physician, so I work with the most frail. And so I really encourage my patients, to, this COVID-19 pandemic is really taking a toll on all of us. And so I'm really encouraging them to help try to prevent it. And one way, the best way at this point would be vaccination.
Absolutely.
In addition to the mask and the hand washing and the social distancing.
Absolutely.
Yes.
Right. And that's, I wanted to get into that. So, as you know, earlier this week, it was announced that over 500,000 people have died from the coronavirus in the USA. That's more Americans who died in 1 year in this pandemic than in World War I, World War II, and the Vietnam War combined. That's bananas.
Yes.
President Biden led the nation in mourning on Monday and commemorated the lives lost this past year. Since December, vaccines have rolled out and millions of shots have been given, but only a small percentage has gone to the Black community, and not because it has not been made available. It's been reported that so far the U.S. has racial and ethnic data for only about half of the vaccine doses given. Among those, just 5% have gone to Black Americans, and only 11% were given to Latino recipients. Dr. Fisher-Mills, why do you think the percentage is so low for Black Americans and Latinos?
Well, one thing is because we have such a great racial disparity in health care for our brown and black skin population, people are very hesitant and they're skeptical about the vaccine. And a lot of my patients now, actually most of my patients, probably 99% of my patients are brown skin, and their average age are in the 80s. And so they remember the Tuskegee syphilis research, actually it was the Tuskegee Project experiment. And so, and actually they're very skeptical about that. And that was not, that was really a dark, one of the most dark sides of medicine in our, in the United States. And it was not, right. But our patients still remember that, and they still feel the disparities when they go to the hospital, and so they're skeptical about vaccinations, vaccinations.
And like you said, they have a right to be skeptical and not, trust the government, because this went on for 40 years. And for the ones who does not know what the Tuskegee experiment is, it was a study of untreated syphilis in the Negro male, which was an ethical, unjustified study conducted between 1932 until 1972 by the United States Public Health Service and the Centers for Disease Control and Prevention. And I brought Tiffany one reason on the show because she did something with Dr. Latham, I'm sorry. You did something.
You can call me Tiffany. It's okay.
I mean, I've been knowing her since we were in a baby pageant together. So we've known each other really all of our lives. So, but Tiffany, back in December, you recorded, and I know you did it, one, because of, the distrust in the community. Back in December, you recorded your first dose, and the following month, your second dose. Why was this important for you to do, and what message were you trying to convey to your social media friends and family?
So I recorded it because, one, I believe in the vaccine. First and foremost, I do believe in the vaccine. As a healthcare provider, I actually have, the unique experience of seeing the patients who have been diagnosed with COVID. I'm cheerful for patients when they, have been treated for COVID and are able to go home and live a productive life. But I've also seen the opposite side, where patients have had a very eventful episode of care and some not leave the hospital, so, resulting in death. And so I've seen the magnitude that this virus has had on individuals. And again, recognizing, as my colleague just said earlier, recognizing that there is some mistrust in the medical community from an African-American standpoint, I wanted to be that shining light, to be that shining example, to say, yes, I'm an African-American. Yes, I'm an African-American provider. I believe in the science. I listen to the science. Thank God that now we have rules and regulations that govern the types of research that can be done from a medical standpoint, so that we don't repeat things like the Tuskegee experiment. So I want to instill in my fellow African Americans that this is a safe vaccine. It's safe. And it wasn't a rush job. What I want to make sure that people understand and know, that scientists have been working on a SARS vaccine for a number of years. Now, it's been, more information and more monies being, given to research over the past year, because we are finally at the point of having a pandemic. But I don't want people to think that this was just a rush job for a vaccine. They've been working on this vaccine really for probably well over a decade, right? So rolling it out was not truly a rush job. I think that, if we could have done probably a better job from a media standpoint, that and in education and outreach, that particularly African Americans would be more influenced to try and obtain the vaccine. To go back to your question earlier, though, when you were talking about the racial disparities in getting the vaccine out to African Americans, I think, as my colleague said too, she works with a geriatric population with patients that are, into their 80s or so. Well, a lot of those patients may not have access, in a sense of, now I'm going to say, a computer, so digital access, right?
Okay, right.
So a lot of times, and you want to be able to roll a vaccine out in an orderly manner. You can't just say, okay, everyone show up at your primary provider's office to receive, because it would be a mutiny, right? You can't do that and safely social distance. So there has to be some order in order to get vaccines in a timely manner. So you have your phases, right? But even still, signing up for that. If people don't have access to computers, then sometimes it becomes difficult to do it. I'm happy to say now I'm seeing within the African American community, churches, community, grassroots organizations are now going out and reaching that most vulnerable subset in our African American community, to make sure that they can get registered to receive a vaccine.
That's good news. That is good news to know, because and I know Dr. Fisher-Mills, since you work with older patients, and like Tiffany, like Dr. Latham said, I'm sorry.
That's okay. Feel free to call me Tiffany. We go back like 4 flat tires. Come on now.
You're right. Okay, Tiff, and you're my soror. Okay.
Exactly.
When Tiffany said that, the internet, most of them don't know how to use the internet, or they don't have it. So, Dr. Fisher-Mills, did you have to help them with that aspect?
Yes.
Yes.
Okay. And like I said, I work for the Dallas County Hospital, so we serve the underserved in Dallas County. And again, access is can be challenging, especially for older patients. Even if they do have access, they don't know how to use the phone or use a smartphone or computer.
Right.
But we actually made appointments for them, and we called them and made appointments for them. And there are churches and community services in Dallas that are actually for people who may not be elderly, but they may not have access. They may be part of the group, the phase, who are eligible to get the vaccine. They may have diabetes or other chronic health diseases. They don't have access to make an appointment. Well, they have community services and outreach and facilities and churches who are helping them sign up for the vaccine. And even my father lives in Houston. He did not have to sign up. He's part of the Methodist system in Houston, and they actually called him and my stepmom. They're in their 70s.
That is
so awesome. They're actually the healthcare systems. If you have people who are connected to the healthcare systems, they are trying to reach the patients. But there are some people who never go to the doctor, and they don't have a healthcare system they're affiliated with. And those are the people who we will have to go out and try to help reach for them to get vaccinated, the ones who don't have primary care doctors or healthcare systems they go to.
Wow. I'm glad that you guys are doing that. That is awesome. Just to know somebody. Go ahead.
Like Tiffany said, it's very important for African Americans to see other African Americans getting the vaccine. This to say it's safe. I wear my badge, and I have both my stickers on there from the first dose to the second dose when I go see my patients. I tell them, eventually if we all get vaccinated, we can loosen some of our gowning up. Like when I go to their homes, I gown up, put the bonnet on, put everything on like I'm going to a Cova unit when I go to their homes. And eventually, that's the whole purpose for most of the community and the society to get vaccinated, so we can have a true herd immunity, and not because of infection, but because we're getting vaccinated.
Right.
And so,
go ahead.
Yes, go ahead.
Sonja, one of the things I wanted to point out too is, I believe in social media, so I maintain a Facebook account. And I really try to maintain communication with a lot of my friends and family members and colleagues in Mississippi and in Jackson in particular. And one of the things I'm excited to see is that there's been sort of a consortium, if you will, of pastors within the African-American community that have had their COVID vaccine, and they're either recording themselves getting the vaccine and or posting a picture of them having gotten their vaccine,
Right.
Again, as another way to encourage their parishioners to strongly consider getting the vaccine. What bothers me more than anything is that, people don't have enough information to make an informed decision. And you may have someone on social media saying, oh, well, don't forget about this study, or, oh, don't forget about this. And so you hear that one piece of negative information, and you tend to run with that rather than truly following the science, following the data, right? Yes. But I'm so happy, like I said, I'm watching social media. I'm very careful about what I post as it relates to the pandemic, as it relates to the vaccine, because I want to make sure that what I'm reporting is accurate information.
Right.
In hopes that I'm able to convince someone else to strongly consider getting the vaccine, if not for themselves, for their relatives.
Right. And
for their friends, for their coworkers, right?
Right. And I was going to ask you, did your video encourage anyone to take the vaccine, or ones who were totally against it, did they at least reach out to you and ask questions?
Yes.
That's good.
Yes, to both of those. And I got a lot of people who called me afterwards to say, thank you so much for sharing your story. Thank you for being open and transparent. Hey, did you have any symptoms? Hey, what did you do about this? And wanted to really talk offline to get more information, because, again, I think initially a lot of people were very skeptical.
Yes.
Because of the rollout.
Yes, and that's exactly what I've been telling people. I tell them the science. I tell my patients, you know, like you said, Tiffany, this was not a warped, so to speak, what we say, vaccine. It's been in the making, and also it's gone through the phases of vaccination trials. It did not skip any phase of the vaccination trials. The only thing is when we saw it was deemed safe and effective, then the FDA approved it for emergency use. So that part was swift. Usually the FDA doesn't approve it like a drug or a vaccine as swift once it goes through those trials, those phases. But this was all, it went through all 3 phases, and it was deemed safe and effective. And so I tell my patients this, and I go over the possible side effects, and we go over the ingredients. And because of that, I have patients between 85 and 95 who've gotten vaccinated, they go to a drive-through vaccine since they're frail. They're hard to get out to go. So I have them go to a drive-through vaccine, and they wait there 15 minutes, and they left. And I always encourage them, when you go get your vaccination, that you should get a paper with a CDC vaccination form, and you register, and then they will give you a survey, like the first 3 days after the vaccination, and then weekly, to check your symptoms and see how you're doing. And if you're having any adverse effects, the CDC will likely, it'll tell you that they will contact you. And I tell them my experience with the vaccine. I had the Pfizer vaccination. The first day, I didn't really feel any pain in my shoulder, my arm, and then I had a small headache, and I felt a little nauseated. I took a Tylenol. I felt better. The second time, the exact same thing happened. I had a slight headache, slight nausea. I took a Tylenol, and I was better. My arm hurt a little bit more, but it was no different than me getting another vaccination. And I encourage all my patients, I'm from 85 to 100. I encourage them all to get a vaccine because, we don't want them to get the alternative of COVID-19, because I've seen, like Dr. Latham said, I've seen the side effects of COVID. I've seen the effects, the consequences of it, the people who didn't come home from the hospital, the people who are home and are still struggling. I have patients who've had COVID, and thankfully they've survived, but they're struggling now. I mean, it's been weeks and months, and they're still struggling. And for my patients who've had COVID, we recommend they wait 90 days to get the vaccine, but we still recommend they get vaccinated.
Okay.
And also, when they do get vaccinated, it's also recommended that you wait at least 2 weeks to get any other vaccinations.
And so you had Pfizer. Tiffany, which vaccine did you take?
I had the Pfizer vaccine as well.
Did you have any side effects?
Minor arm pain, and I will tell you, my arm actually hurt first when I did my annual influenza vaccine. I did have just a little bit of arm discomfort, but that's better than the alternative. I'll take it any day over COVID, for sure.
That's true.
Now, but I've been very honest with people that I talk to, because I have colleagues who actually had body aches, chills, headaches as a result of the vaccine. So it's not a one size fits all type thing. So, but again,
but the benefits outweigh the
outweigh.
Yes,
exactly.
That is so true.
So and basically after you get the first dose for Pfizer, is usually you start developing an immune system immunity toward it about 12 days after the first shot, and then after the second one, it's about 7 days, and you should start developing about 95%, immunity, efficacy.
Okay, that's good to know. Go ahead.
Oh, and the Moderna, it's about the same. It's about after that second shot. I think it's about similar to the Pfizer.
Okay.
And so, in the Johnson & Johnson vaccine, they're expecting that to be approved for emergency use on Friday, and that's a one-dose vaccine.
See, I was just about to ask you that question. So it's this Friday for that, and could you tell us what will be the difference about this vaccine compared to Moderna and Pfizer? You already said it'll be one dose, but is it 100% effective? I've been reading up on it, but what Can you give me more information on the Johnson & Johnson?
Yes, so the Johnson & Johnson, the efficacy, well, for the efficacy for the Moderna, it's about 94%, and for Pfizer, it's about 95% after both the injections.
Okay.
And for the Johnson & Johnson, they have an overall efficacy of 66% for a moderate to severe case of COVID. And they say overall about an 85% overall efficacy for severe cases.
Okay.
So it's actually less, it's a little bit less efficacy. However, you still are getting a good effectiveness one vaccination. And that's going to be beneficial because some of our patients are not going to go back for their second vaccine, their shot.
Mm-hmm.
And that's the thing. When you need 2 doses within almost a month of each other, that's the thing you run into. Some people, for whatever reason, may miss that second dose or may have a delayed. They may get it delayed, the second dose, which they should get even if they miss the second dose and it's within a week. They should still go back and get the second dose.
And see, that was one of the questions I was going to ask. So, for instance, people who could not take the second dose last week due to the snowstorm, will that be an issue?
It will not.
The effectiveness?
No.
It will not because it's a booster.
Yes, it's a booster. And technically they should get the efficacy, yes. And that's why the second vaccine, you usually have a little bit more symptoms than the first because it's a booster. Your immune system's already seen, that, and it kind of boosts it. It's just a booster vaccination.
Gotcha.
So,
okay.
so technically it should be effective. If they miss it, within a week. They tell you that too when you get the first one. If you miss the second one, please come back for the second one. If you missed the the second one, please come back.
And okay.
You don't have to start the process over. You get the second vaccine.
Okay, gotcha. So, okay, ladies, so I do have a few questions. Some questions are mine and some questions are from people who knew I was doing this show. So you've answered the first one. Tiffany, let me ask you this. Can you contract COVID in between doses? And if so, will the effects be lesser if you've had the first dose already?
So, yes, you can contract COVID even after you have had a vaccination. The chances are, though, if you were to contract COVID, that your symptoms would not be as severe as if you had not had the vaccine. But to answer your question, yes, in fact, you can. And I have seen that.
Okay. And Dr. Fisher-Mills,
yes.
Is the vaccine safe for people who take medications such as high blood pressure, diabetes, diabetic medicines?
Yes, and in fact, the patients who are most vulnerable, and we are actually rolling out the first phases for, these patients are frail, elderly with medical conditions, and often they're probably on multiple medications just from their chronic medical conditions. And so it's safe. And like I said, I've had patients, my patients are in their 80s, their 90s, and they've had their own multiple medications, and I do not hesitate, and I have not hesitated to encourage them to get vaccinated.
Okay. Sonja, just one more thing just to piggyback on her comments there. Also, when we look at patients who do not necessarily fare well with COVID, it is the patients that have these comorbidities such as hypertension, diabetes, cardiovascular disease. So they tend not to do well with this virus. And so it's even more reason why you see the phases of patients, and you'll see where, phase one may be, your healthcare providers, right, law enforcement agencies, teachers, but then that next phase is older, citizens who also have these comorbidities. When you get to the next group, it may be, 18 to 65 if you have certain comorbidities. So we're trying to vaccinate patients or individuals who have these comorbidities because we know from a healthcare, standpoint, that they tend not to do well. Those are the ones who, have a longer or prolonged, if you will, episode with COVID, and some, frankly, just don't survive. When you look at the death rates these sombering death rates that we see on television each night, most of those people had comorbidities before being diagnosed with COVID. And so that's yet another reason why it's so important to roll this vaccine out, because, again, we want to get people, not to even experience this, right?
Yes. And one thing also, you mentioned about can you get COVID even when you've been vaccinated, and that's yes. But COVID vaccine does not cause COVID-19. And I've had patients who've gotten, the flu, and they said, they gotten the flu vaccine. They said, I got the flu with the flu vaccine. And you can get an immune response to develop antibodies. And sometimes I tell my patients, you could have gotten exposed to the flu prior to your immune system being strong enough to fight off the flu, because it takes about 2 weeks for the flu vaccine to actually build up a strong enough immunity to try to help decrease the flu or to prevent it. So if you've gotten the flu vaccine and you got exposed to the flu within a day or two, you may get the flu because you just haven't developed immunity to it. So the vaccine didn't actually cause the flu. It's just that you just hadn't developed immunity to it. So some people refuse to take the flu vaccine after that because they think the flu vaccine caused the flu. But just like the flu vaccine does not cause the influenza flu, the COVID vaccine does not cause COVID-19. And you just have to give your body a chance to develop immunity to try to help prevent getting it or decrease the severity of it if you do get it.
Gotcha. Okay.
And it does not change in the Pfizer and the Moderna vaccines, they do not change your DNA. It does not work that way.
That was another thing that's been out. Yeah. So you mentioned the flu shot. So is the COVID vaccine similar to the flu shot, Tiffany?
I would say it's similar in a sense. They're both viruses, right? The influenza virus, and now you have this COVID virus. So similar in a sense, but there are different strands of influenza, and so each year scientists are trying to develop vaccines to target the most prevalent strand of the flu. Just like there have been different strands of the SARS virus, right? With the COVID-19 being most prevalent, which is why I said scientists didn't just start working on this vaccine in the last 12 months. This has been something that's been going on for well over a decade. It's just been the warp speed part of it, of rolling out the vaccine. But yes, somewhat similar in nature. So now what the big question is, and I don't know that I don't have an answer for it just yet, is whether or not, we may end up doing a booster shot for this COVID vaccine, annually going forward. We don't know. It's had such a large impact. And there's still other variants. You've heard of at least 3 or 4 other variants that are now, becoming more and more prevalent. So I wouldn't be surprised if, in the future we had to take yet another booster vaccination for this.
Okay. And so, Dr. Fisher-Mills.
Yes.
Tiffany, just to piggyback off what you said, you just mentioned about the new variants that's coming about. Will any of these vaccines, including Johnson & Johnson, because they were saying that one would definitely do it, I think, be strong enough to fight against the new strands of the virus?
Yes, they're hoping, they're actually saying that Johnson & Johnson may be effective for some of these variants. But for the Pfizer and the Moderna, we, like Tiffany said, we may have to get booster. They're still working on that. We may have to get booster vaccinations to try to help the variants. But even if there's variants, there's still that first one, the COVID-19 vaccine. Virus that was out there first, and people are still dying from that. Not the variants, but the first one that we've seen. So we still want to get people vaccinated for COVID-19 with the Pfizer and the Moderna and Johnson & Johnson when it comes out. And Actually, the variants have shown that if they do have cases, they're less severe, and they're more infectious. Like, you can catch them easier, but they've been shown to be less severe than the prior. So the variants have looked like they're less severe cases, even though they're more infectious. So we still want to not wait for a new vaccine to try to get the variants. We want to still get the Pfizer and the Moderna if it's available for you. Most places don't give you an option. Whatever is available is usually what you get, and that's how it was with me when I got mine in December. I got my first vaccine December the 10th, and my second one December the 20th, and I got my second one on January the 10th, and I didn't have an option. I had to, I got Pfizer because Moderna wasn't out at that time.
So can you, and either one of you can answer this question. So can you mix the different ones? Can you have a Pfizer? Okay.
You cannot.
No. If you get the Pfizer, the first one, you can get there's no mixed match. There's one. You get the one.
Mama, no, you cannot.
You cannot. And let's get that message out there. True. I mean, that's why I had to. Cannot.
When Dr. Fisher-Mills was saying that, I was like, you know what? Because think about the people who may have gotten Pfizer or Moderna, and then they found out Johnson and
yes, and they want that one. Yes.
Yeah. And
I hate to be like that. I have a 12-year-old, and they used to say when he was younger, you get what you get, and you don't throw a fit. I mean, really, the whole point is we want you to be vaccinated, and all of them have been deemed safe and effective. So that's the whole point. Okay. So if they have a Pfizer for you at your location, I would take the Pfizer. If you're not allergic to the medication, they'll show you the list of ingredients when you get it. And if you don't have an allergy to those, then I would take that vaccine, the one they have available.
Gotcha. Tiffany, will we have to wear masks after receiving both doses of the vaccine?
Yes, I wear a mask every day. A mask will be a part of our lives for a while, and I'm okay with it. And I would hope that everyone else would be okay with it. If it saves lives, let's do it. But I wear masks all day, every day pretty much. So I think that they will be a part of our life. And social distancing, I think, we're going to be doing that for a while as well.
And I actually just read something what Dr. Fauci had mentioned about, will you wear a mask? And that's the whole goal, is to get most people vaccinated. That was one question. And he said, the CDC may have some upcoming new guidelines about if you've been vaccinated. So, for instance, if your family's been vaccinated and you have if your household has been vaccinated and your other family household has been vaccinated, can you go over there without a mask? And he mentioned the CDC, they're looking into that to see, the new guidelines, if both households have been vaccinated, then you likely won't have to wear a mask. But that's down the pike. That's not right now. Okay. Even if that's not the guideline now, but that's a guideline that he says that may be in the works once we start getting more and more people vaccinated. That's one thing the CDC is working on. They have advisory committees, and they revise the CDC guidelines, and that's one of them that may be coming along in the pike since people are getting vaccinated now.
Gotcha. Okay. And I'm going to ask this question. Well, last month, and Tiffany, my cousin Serena Gregory, she's a scientist, and she actually, I, like many blacks in the community, I was, been having issues with this. And so she gave me, sound advice, pretty much a lot of the stuff that you guys have said this evening. And I was like, 80%, I'm going to take it. I'm going to go ahead and take the shot. Well, I went over to my mother's. My mother is 79 years old. She was here when the Tuskegee experiment happened, and she remember a lot. She's from Mississippi, and she has a lot of distrust with the government in some ways. And I mentioned to her, what Serena told me or whatever, and she said, "Well, you better hope, if you take it, they don't give you another something else other than what the vaccine is. So my question is, will the Black community receive a different kind of vaccine, or is everybody getting the same vaccine? Because
everybody is getting the same vaccine.
Feeling that way.
Right, she's not. And again, there's been this mistrust, and I think that if, we as healthcare providers, we have a duty to inform, right? And we have a duty to use accurate information. So no, there is not a different vaccination targeted towards, the Black or African American community. It is not. We are all getting the same vaccine. Now, I also received the vaccine, but then for probably 4 or 5 weekends, I actually administered the vaccine as well, right? I did not have different vaccines to give people based on their ethnicity. So that please, let's not pass that misinformation on to anyone. Let's stop that now. So everyone gets the same vaccine, either the Pfizer or the Moderna, and if and when the Johnson & Johnson is approved, then some people will be getting that particular vaccine.
Gotcha. And
we always want to just make sure we're giving accurate information. And so when we hear that misinformation, please commit to just stopping it right there and saying, no, that is not true. It's unfortunate that, a lot of our older relatives, have this mistrust and distrust in the health community. But please, let's put that misinformation to rest, because we definitely don't want to, fume that type of rumor.
Exactly, because it freaked me out, and my 80% went down to 50. So
okay, well, let's try to bring it back up after tonight to like 99.999.
Well, that's.
And then I want to see you with your picture on when it's time for you to get your vaccine. I'd like to see your picture on social media.
My gosh, really? Oh my gosh.
Yes.
Okay.
I challenge you to do that, Sonja. Come on, Sonja.
And your mother, Sonja. We'll get your mother on board also. That question, I've had the same exact question from my patients.
Wow.
They're going to give me a different vaccine than they give the other another person. And I had to explain to them it does not work that way in the vial.
Absolutely not.
We're not in the conspiracy. We're in a pandemic, and we really, and as healthcare professions and as physicians know, we do no harm. That's our main goal, to do no harm.
Correct.
We have to understand this is science. This is science. This is healthcare. This is not politics. This is not about any type of political party. This is about human life, and we're trying to do no harm, and we're trying to get everyone vaccinated so we can get out of this pandemic and people will stop dying.
Amen.
Now, Sonja, may I ask a question of you?
Yes.
Okay. With She Say Sports, so again, I'm a JSU Tiger, true blue, bleed blue, the whole nine. Absolutely. Now, I will tell you, I saw some pictures Sunday from our first football game, right?
Mm-hmm.
I didn't see as many masks as I would like to have seen, nor did I see people social distancing. So for you, you're like my boots on the ground, ears, local ears, if you will. What was the message being sent at home for fans who wanted to actually attend the game in person? Like, I saw a lot of pictures where, people were taking pictures and smiling, and you didn't even see a mask in their hand, and their hands were visible. I'm like, well, was the mask in the pocket? And maybe we just didn't see the mask, or a lot of people were just like still very close together. And for me as a healthcare provider, I cringed at the fact that I saw that there was that lack of social distancing, the lack of masks, because there are a lot of asymptomatic carriers around too. So,
right.
You have to think about, things, and I want to make sure, I want to make sure for everyone, but I want us to do better, right?
Right.
So what is being said Sunday, down there?
Well, Sunday, first of all, they did, like every other row, and the pictures that I took, I don't know if you saw them, but the pictures that I put up, or the video I had up, because one lady did say something, Pamela, she was in our class at Provine, but she was like, y'all sitting kind of close. The way the video was done, we were not sitting close. Every row was every other row was empty.
Okay.
And the people that you saw together, where I was, these were families. So they were families together.
So clustered together, okay.
Yeah, whether they lived together in the house, I don't know. but they were families, and they had on masks.
Mm-hmm.
I did see some.
Oh no, not right. And it wasn't every picture I saw, but I'm not picking on you for your pictures, because
no.
I saw plenty of other pictures on online.
No,
you know how social media is.
I'm just saying, from what I saw, I agree with you.
Mm-hmm.
I saw a few people, they were younger adults,
mm-hmm.
like the college kids, and they didn't have masks on, and it wasn't in their hand. I'm like, what is going on?
Right. So what I don't want is for us to be careless about it, because, I mean, as we all know, our college students, they are in probably the last phase to be vaccinated. So again, could be, these asymptomatic carriers, and you think about a college campus, a dorm setting where you have cluster of individuals. I just don't want people to be careless, right?
Absolutely. Yeah, you're right.
So just thinking about it, and again, I didn't know what the message was sent at home, because, again, here I am, in Virginia. So
right. No,
just living vicariously through all my Tiger friends at home.
Right. They did have city guidelines. Did everybody follow them? No. It was a few people that did try to sit behind us. And, they can read. They saw the sign, because they have them stuck on the bleachers saying, skip this row.
Oh, that's good.
And so I turned around and I was like, hey, you're not supposed to sit here, because they were like right behind us. And so they was like, oh, okay, and they moved, but they saw it. They just didn't think anybody was going to say anything. So, but yeah, for the most part, they were pretty much following the CDC guidelines as much as they could. Right. One more question before we go, and either one of you can answer or piggyback. Is it safe for pregnant women to take the vaccine?
So I think that, and I can't think of which company now, but someone has actually just started doing trials with pregnant patients. Dr. Mills, do you recall which?
Yes.
Which,
I don't know which company it is, but right now it has not been recommended, because it hasn't been. They haven't been in the trial phases. They didn't include pregnant women, just like they didn't. They had children who were 16 years and over. So the vaccine is for 16 years and over. In October, I believe it was I don't know which one it was. If it was Pfizer, it was either Pfizer or Moderna. They started. They included the 12-year-olds. So they're under 12 years old. And then in December, the other vaccine, I don't know if it's Pfizer or Moderna, but both of them at this time or have included 12-years, 12-year-olds and up, for the vaccine, to see if we can get some of these kids vaccinated, the younger kids. And then but as far as for pregnant women at this time, it has not been recommended. And actually, that's one question I asked you: or do you plan on getting pregnant, or are you pregnant when you get the vaccine? But they are starting to do trials on pregnant women.
Okay, that's good.
But yes, so we don't know the effects if you do get the vaccine and you become pregnant, or you're pregnant because they weren't included in the trial. So we don't have that information.
Okay.
So as soon as it says it's deemed safe for children, 12 and up, if they even go down from below that, if they start looking at children, my son, who's 12 years old, will be vaccinated, because kids, even though you see the younger population usually they fare well, they may be asymptomatic, but kids have gotten it and they have struggled with it, even not just not in the hospital, but they've had like complications with their heart, the heart line and the muscle, and and so they've had they've having effects on their myocardium, their heart muscle, and I've seen a 12-year-old who's had that. He was a soccer player. He can't go out and play anymore. Wow. And so he's 12 years old. He's struggling with that now. And he was a healthy 12-year-old boy. He did not end up in the hospital. He got over it, but then he started getting fatigued with his soccer playing. So he cannot play soccer at this time. So even though, so when I see the kids and the teenagers, they think they're invincible, it can affect you in an adverse way. It can affect your whole entire life. So we want to make sure that you're safe, the kids are safe also.
Okay. Good deal. Well, ladies, it has been a pleasure speaking with you this evening. Thank you so much for the information. I pray that many who are still skeptical, including myself, I feel better now, ladies. I feel better.
Wonderful.
Good.
I want to take the Johnson, though, Johnson & Johnson.
Is that because you want one dose, Sonja? Is that why?
Yes. I want one dose. I want to be done.
Whatever it takes.
One and done, okay.
One and done.
Okay, yes.
One and done. So I'll be looking more into that. And please, ladies, send me any information, because I know they're trying to just, right now, for the, the elderly, the nurses, teachers, and, policemen and stuff, I know they're trying to get them done. And, I don't want to take anybody's spot. So,
and as more vaccines start to roll out, you will see other phases begin to get access to the vaccine. Mm-hmm. So I don't know that your wait is going to be very, very long, right?
Yep. I had a friend take it yesterday. I have several that have taken it. So
great.
I think that's me just, yeah. Anyway.
Well, we are trying to convince you. And again, ultimately it's up to you, but follow the science.
I will. Thank you so much. And is there any information that you ladies can leave with the listeners, like if they have more questions or concerns, any websites?
So actually go directly to the source. So to either the Pfizer website, to the Moderna website, to the CDC, Centers Disease Control. Go to either of those websites. And then, for listeners wherever they reside, look at your health department. So, for our fellow Mississippians, look at the Mississippi Health Department. Look at the statistics. Follow the science there. I pulled up the Mississippi Health Department today just to see what the numbers look like in Mississippi. They're staggering. But there's a lot of information within the COVID website for the state, too. So there are plenty of resources that are available.
Awesome.
That CDC website is an excellent resource. They can talk about all the vaccines, too, and just their guidelines. So because everyone's not following every guideline, it depends on the company or, the area. But the CDC has their guidelines for COVID, isolation, quarantine, vaccination. They have all those guidelines. And actually, if you go to your county site, they should have the CDC guidelines on the county site and the local guidelines also.
Gotcha.
So if you
and
go
what
to your
phase
local county,
and what phase they're in as well.
Yes.
Okay. And Sonja, if you don't mind, just encouraging your listeners to really try and reach out to older people within the community, within their family, who may not have access to computers or smartphones, but to try and help them to get registered to receive a vaccine, provide transportation if necessary, but really try to help them to gain access to the system.
Absolutely. And, especially, when we grew up, and I think still now, a lot of, in the Black community, especially grandchildren, they love their grandmamas and granddaddies.
Right.
I was very, very close to them, so I know if they were still alive, I would definitely be trying to, make sure they got this vaccine and did the work for them. So definitely out there, do the work for the grandparents, your elderly parents, who don't have smartphones, who don't know how to, work anything online. Just help them get this done so we can get back to living our lives. That's right. That's true. So, well, guys, before I go, guys, make sure you follow me at She Say Sports on Facebook, She Say Sports 23 on Instagram, and that's my show for today. Until next time, this is Sonja with She Say Sports, and I'll see you on the radio.